Hello, I'm Dr. Amy Hunt with the Cal Health Center, and I'll be giving you an overview of the fiscal year 2021 Cooperative Agreement Instructions and Training. I'll be covering the Cal Health Goals section within the Grants and Agreement Guide, go over the guidelines, and give an update on our reporting requirements. Please note that the animal disease traceability activities are covered in a separate presentation and section of the guide. So the Cal Health surveillance and outreach goals haven't changed much since the last fiscal year. It's still important to conduct surveillance in domestic cow and bison and continue targeting high-risk wildlife populations to maintain national, state, and herd disease status certifications, as described in program regulations, standards, and surveillance plans, as well as to respond to identified outbreaks in cattle and bison and continue outreach efforts to complement program activities. For specific program guidelines around brucellosis, there are separate guidelines for Idaho, Montana, and Wyoming, which are around the greater Yellowstone area. We have brucellosis management plans in those states that cover surveillance activities, including implementing risk-based management plans to mitigate risks associated with wildlife. We also expect them to hold at least one meeting between state livestock officials and wildlife officials, continue to encourage abortion screening in cattle, conduct epidemiologic investigations and other program activities as appropriate, and provide education to state, tribal, federal VMOs, animal health technicians, animal identification coordinators, and other appropriate animal health officials. For states outside of the greater Yellowstone area, we still expect them to provide education to state, tribal, and federal VMOs, AHTs, and AICs, as well as encourage abortion screening in cattle and support brucellosis epidemiologic investigations as necessary. For BSE, we expect all states to collect samples to achieve state-level goals defined in the BSE National Sampling Plan. Collection should represent the clinical suspects over 12 months of age, non-ambulatory or emergency slaughter over 30 months, and fallen stock over 30 months. We also expect states to conduct outreach and education with accredited veterinarians and producers to encourage sample submissions in support of the national surveillance goals and sample collection targets, as well as conduct outreach and education with public health officials and public health laboratory directors about forwarding rabies negative submissions from cattle to the NBSL for BSE surveillance. For cattle fever tick, primarily in Texas, we expect them to conduct targeted surveillance inside the permanent quarantine zone, coordinate wildlife hunting surveillance with local, state, and federal entities, provide tick submission program data and surveillance disease testing, and continue collaboration with Mexico. We also expect them to collaborate with TPW on white-tailed deer census and fever tick surveillance, and collaborate with APHIS-ARS on joint fever tick research. For tuberculosis, we expect all states to continue visiting state-inspected slaughter establishments to validate slaughter inspection, conduct outreach, training, and education with accredited veterinarians to ensure compliance with existing performance standards, implement a system to monitor CFT response rates, and conduct epidemiologic investigations as appropriate. We also expect states to provide travel funds once we're able to travel again to cover costs for state VMOs to CCT trainings. For states with a bovine tuberculosis detection, we expect them to conduct targeted surveillance in geographic areas where TB has been identified, implement herd plans and management strategies, implement statewide risk-based management, and conduct wildlife surveillance to determine if TB is present in the wildlife. For our other program activities, the blood and tissue collection, we expect states to assist VS in bringing slaughter plants and all rendering plants into compliance with the BTC rule or in conducting quarterly inspections. For reporting and data entry, we expect complete applicable monthly NLRAD NARS reports, complete data entry through our various databases. And then for preparedness and response activities, we expect states to prepare and maintain and exercise state-level plans, investigate, control, and eliminate emerging endemic zoonotic and BADs, and implement risk-based management plans to mitigate risk. And finally, for an update on our surveillance data quarterly reporting, we're still developing this reporting mechanism, kind of revisited what we had developed last year. But once we start that rolling, we are expecting states to supply surveillance and outreach data to the ABIC for those program activities that the area office does not have available. And we're still targeting a quarterly basis reporting to hopefully avoid that 11-month request in September. Data should be submitted through surveillance and activity reports and may be used to inform decisions about future agreement funding levels. So thank you for your time and attention. If you have any questions or comments regarding this presentation, please feel free to reach out through email or to your ABIC. So thanks again for joining.